It's your favorite nurse, Stephanie, and welcome to Plan Senior Moments. This is the podcast that helps you learn how to keep your parents safe, avoid unnecessary hospitalizations, and support them in aging in place with dignity and confidence. Most of my clients come to me during a time of crisis. Mom's in the hospital, things have changed drastically, and suddenly you're scrambling to come up with a plan of care. But it doesn't have to be that way. With each episode, I'll share real-life stories, expert advice, and practical tips so that you can be proactive, not reactive when it comes to senior care. Let's get started. Hello and welcome to all of our guests who have tuned in to today's episode of Plan Senior Moments. Today we have Jessica Mannix with Fox Rehab. Jessica, thank you so much for joining today.
Thank you for having me.
You bet. So generally what I do is I work with adult children who have aging parents, and they need many services to come into the home so that they can age in place safely and avoid unnecessary hospitalizations. And your organization is just phenomenal. You're able to provide physical therapy, skilled speech therapy, occupational therapy services, and you're able to go to the home. So please tell us more about your role with the company and the services that you offer.
Yeah, absolutely. So to give a little background on Fox Rehabilitation, so like you said, we do offer physical, occupational, and speech therapy services. We're geared specifically towards serving seniors. So we go to their homes. We operate just as an outpatient clinic that people are familiar with from driving down the road and seeing them around. We operate the same way, except we just come to the seniors in their homes. And that has a lot of different benefits that come with it. The obvious is it takes out the need for transportation to get to and from the clinic. And it also just gives you the best hands-on environment to really work with those patients and see exactly what in their day-to-day lives might be hindering them and what things might need adaptations made. That way you can really focus your therapies on that. And the way Fox Rehab kind of got started was actually back in 1998 out of Cherry Hill, New Jersey. And then now we are in 36 states total, with Arizona being one of the newer additions. So I'm so happy to have been able to join Fox through this expansion. We are a private practice. We are still completely owned and operated by Dr. Fox, and all of our executives are clinicians who have worked in the field with Fox. So the understanding from top management down is just unparalleled. And yeah, so that's basically how we got here to Arizona. We expanded after 26 years on just the East Coast. I have joined them as an account manager. So essentially, I do everything from business development and marketing to patient intake and family contact. I talk to people, answer their questions, and help them just navigate what options might be best for them.
Oh, that's great, Jessica. So oftentimes it's overwhelming, right? So mom or dad has had a surgery, perhaps a fall, some injury that they've sustained inside the home. They have a hospitalization, possibly a surgery. They may then be transferred into a skilled nursing facility. And then we're looking at discharge home, wherever home is. But oftentimes there's a higher level of care still needed at time of discharge to completely recover or to recover as best as they're able. So when someone is being discharged home, how does that look for a family who needs speech therapy, occupational therapy, or physical therapy? Sometimes we need all, sometimes we just need one or two.
Yeah, so it can look a lot of different ways. As we know, discharge plans are never one size fits all. So a lot of times we are a great option following discharge because, like I've already mentioned, we come into the home, working extra eyes and ears on the living situation after coming home from the hospital. And what we really focus on in those post-hospital discharge is really getting them back to their functionality level before whatever big event happened. It could be a fall, it could be a stroke. And really what we try to do is just identify where those deficits are and then just work from there, focus on what you can do and just build your strength, your mobility, your functionality from there. And a lot of times when people get discharged from the hospital, they do come home with what I refer to as traditional home health. So, with home health agencies, a lot of times the patients need a skilled nursing aspect to their discharge plans, and that could be anything from wound care to medication management. A lot of times they'll go on home health, which does include a rehab aspect to it as well, but it's typically a shorter plan of care,
Right.
maybe just a couple weeks to get those medications or wound taken care of. And then we're a fantastic next step to that because in those first couple of weeks, you really never do get into the thoroughness of rehab that the patient is needing. So moving to us after a home health episode is a great progression because we will come see that patient a lot more aggressively. We try to see people 2 to 3 times per week per discipline. So, like you said, sometimes people need all three disciplines. That means we're spending, let's see, 6 to 10 hours with them every week, which is pretty aggressive in terms of outpatient therapy.
And do they need a physician order?
They do. So often when we're working with people post discharge, a lot of times case managers will set them up with whatever discharge plans they need in place. If for some reason they don't have an order in place from the discharging physician or their care team at the hospital, we can work in tandem with their primary care physician. And that's typically who we work the most with because they're the ones who will then help follow through the plan of care. And since we set our plan of care initially around 90 days and then we lengthen or shorten it based on their needs, a lot of times the primary care provider is the best one to follow that plan of care because they're also seeing them throughout those 90 days.
Yeah, so that's where it gets confusing for a lot of families. Is we just had
Yeah.
home health, and why couldn't we have home health longer? So it's just really complex and hard for some families to understand. And they don't even know that you're
Mhm.
available, right? That you can come in
Absolutely.
and be an extension for a longer period of time to meet those things and help the physicians with the documentation to get it covered by the insurance. Is that right?
Yeah, you're absolutely right. So building awareness that we're a resource that's a big part of my job. And also a big thing that our clinicians do is just educating the patients and the community on what's out there. A lot of people think, oh, I already have physical therapy set up, and they might be going out to a clinic, which is absolutely fine if that meets your goals and helps you with your specific case. But really just having people know that we're an option is, like I said, that's a big part of my job,
Well, and
making sure
it's
people.
huge because a lot of times transportation is the challenge.
Oh, it's the big obvious one. Like I always say, it's the biggest obvious benefit to using our services instead of going to an outpatient clinic. And that's not to say the outpatient clinic isn't the right fit for a lot of patients, because it absolutely is. But when you're looking at the specific patient and exactly what they're needing, with the older population specifically, which again is who we work with, a lot of their difficulties are coming from those activities of daily living. That's when they're at their biggest fall risk, or when they're just truly maybe not able to take care of themselves the way they were previously. And those are the things that need to be addressed. And those are all things that happen in the home, environments you can't necessarily recreate in the clinic. So that's really where the big difference is, aside from the transportation, is just being able to work in the true environment that they spend most of their time in.
So that would include preparing their like the day-to-day stuff, right?
Oh,
Getting your
absolutely.
shower, getting dressed.
Ba- yeah, bathing, dressing, feeding. Obviously, ambulating is the big thing that people think of with physical therapy, walking around, but there's a lot of things that are go to it other than that. I always say physical therapy helps you get where you're going. Occupational therapy helps you do what you want or need to do once you get there. And then speech therapy is a great addition if you have any sort of cognitive deficits. Of course, speech language deficits or swallowing is a big thing that we run into with the older population as well. So, in tandem, they all work together in the home and just really help elevate their day to day life and make sure that they're not only able to do the things they want and need to do, but they're able to do it safely and have that clinical expertise to make those adaptations or accommodations wherever they need.
Oh, that's wonderful. And then when insurance covers it, is there ever a time when they need more, but insurance will no longer cover it?
Yes and no. We're lucky enough to be on that outpatient level. We have a lot more flexibility and less limitations when it comes to how much therapy and how frequently and for how long we can do it. With Medicare, as long as you're able to document the clinical need for skilled therapy and can document progress and deficits and everything is measurable, Medicare, they won't stop paying for it. We have a great quality assurance team in place that helps make sure that all of our clinicians are documenting appropriately, efficiently, and effectively so that our patients aren't running into those issues. But of course, when it comes to insurance, as I know, all insurance plans are a little different. So there are some advantage plans that you might limit each plan of care to 30 visits or 25 visits. And then we always just work on those like case by case basis and make sure we're really using those visits as efficiently and as effectively as possible. Where, yeah, we might not be able to see them for 3 months, but we can see that if we can see them for a month and see them aggressively and make sure we're hitting all those milestones, hopefully they might not need any therapy after those visits are up. So it's always just a case by case navigation. I hope that answered your question.
It does. And I think that's really the probably what you get a lot of questions from when families do contact you. They're looking at their insurance, what they can get covered, but then you work through those details with them. Are there any
Absolutely.
insurances that you just can't accept?
So, unfortunately, at this time, we don't accept any Medicaid plans. So, that's Arizona Medicaid or any of the Medicaid replacements. I know one of the ones we come across often is Mercy Care and the access, all the access plans and some of the local banner HMO plans that are Medicaid replacements. We unfortunately can't work with those in any capacity. All of the other ones, so traditional Medicare is our primary. And then if a patient has a secondary with that, they're typically fully covered because Medicare always covers 80% of outpatient therapies. And that's whether we're coming to you or you're going to a clinic. And that's something that I always like to make sure people understand. Our billing aspect of things is exactly the same as if they were to go to a clinic. Medicare views us exactly the same. So if you have a copay with us and you have a copay in the clinic, they're usually going to be about the same. When it comes to commercial plans, we're in network with Devoted and Scan, which are two of the more local Advantage plans that we are in network with. And then unfortunately, some of the bigger commercial plans like Aetna, Cigna, Blue Cross Blue Shield, Humana, we are not in network with them, which means we can still accept their PPO plans. And it really just depends on the tier of the policy the patient has to see how much it will cover. And if we're not covered, I'm always happy to walk families through other options that I'm familiar with or help them navigate maybe a next step of what's appropriate.
Okay, wonderful. So if there's an issue with their insurance coverage, you guys can help them navigate something that may be beneficial to them. But you also can take private pay, is that correct?
Absolutely. Yeah, we can always take private pay. Our current private pay rates, they're 120 an hour, which is on the lower end for the market, which I'm very proud of. I do know we're making some changes to our private pay structure in the next couple of months. So I'll definitely keep you updated when I have that. But as of now, we do offer it. It's at $120 per hour. And if you do prepay for a set of 10 visits, we do give a 10% discount as well. So basically, it's buy 10, get one free. So that is always an option.
That is nice. I have a lot of clients who live in an independent living community, but circumstances have changed. But finances are no obstacle for them. So they're able to bring in 24/7 caregivers if they need it. Sometimes it's just for a very short period of time after their hospitalization or surgery or something's changed. Maybe
Mhm.
they had a GI bleed that's now resolving, but they became very weak. Now they are having trouble getting in and out of the bed and going to the bathroom and getting showers. So they can afford for that short term, maybe 2 to 3 months, to have that extra level of care, pay for those services that insurance won't cover, but then they're able to recover fully and stay where they want to be, which is their home, and not move to a higher level of care or even sometimes a different community.
Yeah,
So
absolutely.
those things do come up for my clients and families that I work with. They're able to pay for those services out of pocket in the event that insurance, for whatever reason, won't cover it. Here, I know you're in 32 states. Is that
36.
36? Okay.
Yes.
So here in Arizona, where are you able to visit patients in their home?
So I'm personally based out of the Phoenix area, and our we have clinicians all around the state of Arizona. However, where we service, we have them in pockets. So we service all of Phoenix and Scottsdale proper, as well as Fountain Hills now, what is that? Northeast of Scottsdale. So Fountain Hills, Scottsdale, Phoenix, the West Valley. We service Glendale, Peoria, the Sun Cities, Surprise. And I think that's it for the main metropolitan area here. We're unfortunately not out in the East Valley yet. Hopefully, sometime this year, we'll be making that expansion to the Mesa area and then adding on Chandler and Gilbert. And then as far as outside of the Phoenix area, we do also service Prescott and Prescott Valley up in northern Arizona. And then we also, at the beginning of this year, expanded down to parts of Tucson as well. So that's going to be one of our growing markets this year.
Wonderful. This is such a service that our seniors need. That's what I focus on with families, is to bring in all of those resources that they need to age in and place safely at home and avoid unnecessary hospitalizations. And most of the time, that's where people want to be. They want to stay at home, if at all possible.
Absolutely. And of course, we talked a lot about therapies following a hospitalization. But another thing that I really love about our practice, and since we are an outpatient practice, we're able to work with patients a lot proactively like you just said, to prevent those hospitalizations from happening. So to work with us, you don't have to have gone to the hospital. You don't need to have a documented fall. But it could be someone notices their mom isn't really getting up and down the stairs as easily and safely as they used to, and they're afraid they might fall. We can absolutely come in and work with them preventatively to help with their balance and fall prevention. Same with activities of daily living. Maybe nothing happened. Maybe you're just truly aging and losing some of your strength. And now all of a sudden you're having trouble getting in and out of your shower. Well, let's work on it before something happens. And just functionally too, like you mentioned independent living, we work with a ton of independent living. And a lot of times it might not be necessarily a higher level of care that they need, but they might be losing some of the hobbies and activities that they've done their whole lives. So we work with patients all the time who, maybe they're just not able to play tennis the way they used to, and they want to work on some strength, mobility, and stuff and see if they're able to get back to that functionality level and get back out on the court. We can absolutely work with people in situations like that as well.
Jessica, I'm glad you brought that up, because a lot of people think of this as something you need after a fall or after a hospitalization or after a surgery. But really, these services are needed to maintain that independence and their current mobility and strength and gait. So I'm glad you brought that up, because I think it's an overlooked area.
I couldn't agree more, because I think that people think of therapy as a very reactive service. Oh, you're like when you're younger, oh, you had an ankle sprain, you got written a script for PT, you go for 6 weeks and that's it. Or, of course, following hospitalizations or stuff like that. But therapy can be very proactive too. It doesn't have to be just reactive. So that's another thing that I really love to build awareness with, because, of course, if we can avoid those bigger life events and hospitalizations, that's even better.
We want to continue our active, healthy lifestyle for as long as possible.
Exactly.
We want to do those things that we love and enjoy. So, are there any other areas of service that our listeners should be aware of? Or do you feel like we've covered everything for this area?
Honestly, I think that we did a good job covering the bones of what we do. I, of course, could talk about Fox Rehab and our services and our patients and buildings we work with for days. But I think that we covered kind of the fundamentals of it. Of course, if anybody listening or anybody you ever come across ever has questions, I am more than happy to answer anything specific and be that contact person for anybody, especially here in the Arizona region, and answer any further questions or kind of case specific situations. Always have to talk through those.
So, what is the best way, Jessica, for families who have questions or have a loved one, mom or dad, who needs your services, or maybe they're calling for themselves? What is the best way to contact Fox Rehab and schedule that consultation to discuss their needs and get services in place?
So I always encourage people, whether it's families or patients themselves, or maybe care coordinators at living communities, I always encourage people to reach out to me directly. Like I said, I help cover all of our operations here in Arizona. So I have a great idea of availability, coverage range, and all of that. So people are more than welcome to contact me directly. And if not, going through our website is probably the best way. Our website has a ton of information, a ton of patient success stories, a lot about our footprint throughout the whole country. And there are phone numbers there. They do go through our home office, which is still in Cherry Hill, New Jersey. So it will get filtered to me for local questions anyway. So I always tell people if you can just come straight to me, let's just skip that step. However, if you are to call into our home office, they can answer the majority of questions as well, too.
Okay. And what would be the phone number to contact you, Jessica?
Yeah, so my direct cell phone number it is 602-919-6845.
And the website, if viewers listening want to visit the website.
Yep, it is foxrehab.org.
Wonderful. And of course, to our listeners, everything's going to be posted at the end of the video as well to make things easier for you. Jessica, thank you so much for joining us today. I really appreciate you taking the time to come on and educate our listeners about your services that are available to help them age in place safely and avoid unnecessary hospitalizations.
Yes, thank you, Stephanie. I'm so excited to be here, and I'm just happy to help educate and build awareness on what we do.
This is wonderful. Love what you do, Jessica. Thank you so
Thank
much.
you.